Hey everyone, Dr. Alex here. Welcome to another video. This video, probably one of the more important videos I've done. We're going to be talking about the underlying causes of neck pain, and one of the most prevalent ones I see for recurrent neck pain, and that is chest breathing. And usually people start chest breathing when they are stressed. This video is based on clinical encounters that I go through every single day. So one of the cases that I'm thinking about most recently, young lady that we're taking care of, neck continues to improve, getting better, headaches going away, neck pains going away. But every week we're seeing, after a really, really stressful day at the office or at home in this case, that her neck pain and the physical changes that we see in her neck, we see a regression in her progress, and we see a lot of the tension and problems in her neck come back. And so when we looked at her test results, we noticed that it wasn't from an underlying problem in the spine or some sort of movement problem or some sort of mechanical issue. And what we found when we had her down on the table, and when I had my hand and her hand here on the side of her neck on her scalenes, and one hand, her hand on her belly, instead of breathing with her belly, where the chest stays quiet and the belly expands when the diaphragm drops down to let air into the lung, what we saw was that she was doing this. Using the muscles in the scalenes, so using muscles in the neck called the scalenes, using the chest muscles, having a paradoxical breathing pattern. And that's when you breathe with your chest instead of the diaphragm or your belly breathing. And so with this patient, what we did is we spent a few minutes together after her checkup, and we went through this belly breathing plan where I taught her that if she wants to breathe into her belly, she wants to make sure that this hand here on the side of the neck over top of the scalenes, and that this hand here on the belly, this hand does not move. It is quiet. And when she takes a big breath in, it should feel like a tire is inflating here outwards, where the stomach expands, the back expands, and the sides expand like this. We gave her a couple cues where we told her, make yourself really fat, give yourself a really, really big belly, and try to make sure that you draw the air through behind the heart and almost down to your genitals or down to your butt. You really want to force that air down towards the belly button. Some people benefit really, really well from trying to push really hard with their belly button onto their hand. And that takes a lot of practice. So I think taking a step back, how can you know if this is you? Now, number one, next time you're stressed, put your hand here on the side of your neck, put your hand on your tummy, take a big breath in, see if these muscles here, the scalene muscles, see if they tighten, see if you can feel that chest raise up, see if you find your collarbone popping upwards into your hand, and see if you can take a big breath in with keeping this hand silent and only having movement there. Most people are going to notice, especially if you're a neck pain sufferer, especially if you get a lot of tightness here through the scalenes and muscles on the side of the neck, that you are going to struggle with this, and it is super, super hard to retrain oneself. It does help if you have another manual practitioner in the room with you, giving you some cues, but I've given you guys the same cues I would give to any of these patients I work with. And it's going to take practice. It could take anywhere from days or weeks, depending on how ingrained that pattern is. And I think it's important to know why we're retraining this. So when somebody takes a proper breath, when you look at a baby breathe, you'll see that their belly comes outward when the diaphragm lowers down, and that allows the lungs to expand. And then when you're taking a big breath in, the diaphragm contracts, and that pushes the air out. Now, typically with stress, let me take a step back. Typically with exercise, it's okay to get a little bit of chest breathing. The body has evolved for that. But when you go into that fight or flight response, when you are stressed, the spine shifts forward, the head shifts forward, everything tightens up. This is typically when we're going to employ those short, hollow breaths using those chest muscles. And what typically happens over time, or what's really believed to happen over time, is that with more stress an unhealthier spine, a poor structure in the spine, we typically will adopt that chest breathing pattern as opposed to the belly breathing. So if somebody's a neck pain sufferer, this is something that your manual therapist should be looking for to see if it might be one of the underlying causes that actually created the problem with your spine and your neck in the first place. And so when I first heard this in chiropractic school and leaving chiropractic school, I thought, this is dumb. There's no way that the breathing alone is going to be enough to do this. But when you start seeing enough patients and when you start seeing these recurrent scalene tightness, the recurrent neck problems, and you start working with patients and working through this and recognizing that somebody's breathing like 20,000 times in a day, and that if you're doing a few thousand of those breaths with your chest, yeah, you're going to create some problems. So if you're that recurrent neck pain sufferer and neck pain tightness sufferer, try this belly breathing exercise. You're going to have to try for 5 minutes at a time. I usually recommend 2 times per day, and you should start noticing some progress within a week or 2 in your capacity to do it, your ability to do it, and the neck tension and neck pain should improve thereafter. The big asterisk with this, of course, if there's an underlying problem with the spine, this is not going to fix it. It may get rid of some of the tightness, it might improve the problem, but if this alone doesn't fix your neck problem, which it probably won't, and doesn't get rid of your pain, that's when you got to go see a manual therapist. Thank you guys for tuning in. My battery's dying, so hopefully this makes it. Like, subscribe, please. It allows more people to see this. And while you should be doing some neck stretches, of course, to help with the neck and help with its mobility, this is a really, 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 really important topic, a really, really important discussion. And I hope you can put it to good use, and I hope you get some relief from it. And if not, you know who to get in touch with, or go see somebody great in your local area that everyone raves about. You guys take care. We just made it. Battery's going to die.